It's the sisters live.
Thoughts on Substack thus far? We've been doing it for a couple
I
weeks now.
absolutely love it. I think it's so much more authentic and real than like a lot of the platforms. Like people say like TikTok is for like the funny, the trends, sarcastic, like the very like up to date. They say like Instagram is a lot more like curated. And then they say like LinkedIn is like sometimes a little more performative, a little more like expertise based. But I feel like Substack is just like real. It's like honest, it's not like overthought. And I really enjoy it. What about you?
Yeah, no, I've been enjoying it. I been loving like connecting with people and just kind of exploring different, even some different niches of Substack and like different topics. Like I'm really finding myself like gravitating in the morning to like click on it and learn. I just think it's like a fun experience and very real right now. It's still like I'm still grappling with how to grow and how to understand the platform. And there's just so many features and nuances to it. But
Mhm.
I think it's a really cool platform and like been really liking it and excited to kind of like dive deeper and everything. But it's a place. It's a place.
It really is. I've already made some good friends on there. Like there's people that they'll comment and like, oh, the color, like, how's this thing? Or, it's just it's very real. I like it a lot. It feels like how social media was like 8 years ago.
Well, it feels like how LinkedIn was like 3, 4 years ago when I started on LinkedIn. Like very community based. Everyone was really excited to be there. Like just everyone's like excited to build. It feels like LinkedIn in 2022, I would say. Like not earlier than that because there are folks and it has been building. But yeah, I think it's exciting. Excited to grow on it. It's been fun, like all these different sessions and stuff. But yeah, I think I'm kind of excited to kind of go into the topic of the day today about how you and I discuss it all the time, but how we're going to basically see like the biggest rewrite in the healthcare journey in modern history. All because around intelligence is becoming this like personalized, always on real time experience with generative AI and chatbots and wearables and all of those really being connected together. I feel like healthcare for so long. It's so funny. You and I always like healthcare is so boring, but I feel like it's really becoming new and different because healthcare in the past was so reactive. Like you got sick, you went and saw your doctor, and then someone tells you what's up. But now in AI, you detect it early. You're able to kind of chat and like go with your kind of your systems right now and like put in your testing results and everything, and then really co-manage and even prevent anything. I think there's this huge opportunity for prevention. Um, I think the real question is now, and I would love to kind of hear your thoughts, is what does your personalized health journey look like when intelligence is always on and predictive?
I like what you're saying about how it can be preventative. I think one of the key things here is it turns the patient from being totally in the dark on all this. I mean, we have to go to med school for so long. It's so complicated. There's so much to the human body. Like, it's unless you go to med school, it's really hard to get an in-depth understanding of what's going on. But it kind of flips the script a little bit using AI because patients can go in not as just patients, but as more of like an informed part of the process. And they can go in with personalized questions, with a deeper understanding of what's going on so that they can really fully feel like they understand. I know that something that is piece of advice that is given a lot in the healthcare world is that if you have a scary diagnosis possibly coming up, to not go into your appointment yourself, because chances are your brain's gonna freeze, you're gonna forget what the doctor's talking about, you're gonna forget your questions. So they always recommend, go in with somebody else to help you take notes or to help you, keep the topic on like what you need to know in order to get healthier or to overcome whatever you need to overcome. And I think that AI is giving this interesting placeholder here where instead of having to have the other person going with you, you can bring it in with you, have it record your session, and then use it to retain what's going on, all the questions, to retain the information that you're given on like the regimen of care, all these things. But also you can use it before your visit to be fully informed. Ask you questions, make sure that you know what questions you need to ask to get the information you need to know. Something that I did just this past week, I went and got my annual blood work done. And it gives you these pages and pages of all these numbers and all these acronyms and things that just make no sense. And it'll say high or it'll say low or it won't say anything. And that doesn't tell you a whole lot. So I think you did this too. I put it into AI and I said, hey, like, can you break this down for me? Flag anything that I need to talk to my doctor about and let me know, am I like out of the range of norm on things? Are there things that aren't flagged in the data, but that are things I need to even look out for? And it can catch those outliers and even help you personalize it to you. Like, okay, say you're an athlete or say you're someone with a specific health problem, it can personalize it for you in a way that we don't always get in healthcare that's so rushed and go.
Yeah, I think I totally agree with all that. I just think we're becoming more informed humans. Like it's like allowing us to be a better human. I think in the past we always joke about like you have like a rash, you would like research online, and then WebMD would say you have cancer. Like you're gonna die. And so there was really like nothing to turn to. It was literally just doctor's appointments. And doctor's appointments are A, expensive, B, hard to come by, C, usually during your workday. And so it's like we were never incentivized or never had a clear way to discuss our health experience. And health is everything. I think it's really gotten more popular to like biohack and some of those things over the past couple of years since these tools um kind of came to be. So I'm really curious to see 40, 50 years from now, do we start living longer? Because we're able to like be more connected to these things and therefore like plan our lives better. So I think that's really, really fascinating. But I think AI is just helping us to have better, healthier experiences all the way around I think, from being able to connect all of the numbers and put them together. They're so like our health and humans in general is such like a number space when it comes to like blood care, like blood or hours of sleep per night or your heart rate. There's so many numbers. In the past, we could like take them here and there, but now we can kind of have these full pictures. I think we're just barely scratching the surface. We know ChatGPT launched their health, which is still even in wait list. It's not even open to everyone. And the healthcare in general, the portals are just so old and outdated. But I think soon we'll have a very much more centralized view. That's sure when we go into the office, the doctor can log into it, but then we're logging our feelings and our thoughts and all of our numbers daily and having these I think in the future, because right now I think it's very disjointed when it comes to like our healthcare and our numbers and everything. I think we'll have much more better experiences where we see it all together. I think wearables have started to do that, especially those have become more popular, starting with the Apple Watch, now getting into more like Aura rings and stuff. But I think we're having a better experience of not just right now. I feel like it just gives you the numbers. And then B, I think they'll start to include generative AI into the experience. And so that it's always giving you recommendations and things to do and things to optimize their health, just to give us best step health, which is so cool. Like healthcare is obviously relevant to all of us. And so to have this be able to kind of step us up is pretty exciting. I think my next follow-up question too is what are the most under discussed use cases of AI in personal health right now? I'd kind of like to hear your thoughts and then I'll give mine as well.
I know that it's something still being worked on and trained right now, but I know that they're using it a lot for cancer detection and that they're actually seeing better rates of detection with AI than with humans. I mean, human error plays a part in everything, right? It's inevitable that it's going to happen, but I think it's just fascinating that we're going to have these models that are trained on these very specific healthcare topics and to be able to do it better than us for the purpose of saving lives and just totally changing the trajectory of somebody's life. I think it's just amazing. It's to me such a hopeful use case for humanity. And you mentioned like living longer. I think we're going to see dramatic increases in how long people live and more in touch with the knowledge they need to know to be healthier. I know that it's something that's also being tested in like more rural areas, especially outside the United States, on using AI to better inform populations when there's not great ways sometimes to get information across because it involves sending doctors out there or very complicated programs. But you can easily give them some sort of AI agent that has this detailed knowledge and can walk them through it and help them be more informed. So I think that we'll see, especially outside the US, like dramatic differences. I'm pretty excited for it. I think it's very
Yeah.
cool.
Yeah. I mean, I feel like there's so much doom and gloom when it comes to AI and, like taking jobs and also like the energy costs and the privacy behind it. But I feel like AI in healthcare is a really like light for everyone. I think the early detection of common diseases is one of the most exciting things because we're able to have, let's say, these personalized dashboards of everything, or ongoing trends every time we go in and get our blood work done, our sleep, like everything, compared against like all 1 million common ways that people get sick and die and pass away. Like being able to compare those together and have something always on and giving us those thoughts 10 years ago would cost like millions a year for doctors and testing and like having someone like basically be your own personal doctor, or even specialization of board of doctors for yourself. And so the fact that like humans can have those is crazy. Because I think with the rise of all the things from microplastics and eating more processed foods, all these things are causing us to have earlier scares and earlier things. And so I think being able to combat that, well, we should all have less processed food and microplastic. Being able to combat that with AI is for early detection and all that is just incredible. I think that's something I'm really excited for when it comes to use cases of personal AI. I think additionally, we're talking about like being able to diagnose like the worst in the diseases. But I think on the other hand, of being to be prescribed better ways to live, better experiences, like being able to take an aggregate of like the best athletes out there, the most healthiest people. Everyone talks about blue zones, about how healthy those folks are because the foods they're eating, the sleep that they're getting. So being able to prescribe different lifestyles based upon the best in the world. I think that's something I'm like, I want to know like what those folks are doing, like what their numbers are, like how they're optimizing the data within their blood. Like I think that's so fascinating too. So I think being able to diagnose the negative, but also prescribe the positive is really exciting as well.
Yeah, it's gonna be an exciting time. I'm excited to see where this takes humanity.
Yeah. My other question for you too is, do you think that there's any negatives of AI in healthcare?
Definitely. Definitely negatives. I think we have to be so careful when it comes to talking to chatbots about our health because the chatbots want to be agreeable, right? They want to be right. They want to be agreeable. They want to please you to a certain extent. So I think we have to be very careful there in making sure we're getting the right information and not just what it thinks we want to hear. I think it's important that when we are fine tuning these LLMs, that we make sure that they tell people if it's not 100% sure, which it probably should not be 100% sure at this rate, or if it's something that's even looking potentially serious, that they go and get it checked out. Don't just rely on the AI to tell you what to do. I think it's great for advice, but they're not FDA approved. They can't diagnose. They don't have a medical degree. They don't know the full picture because they're not here in front of you. So I think it should be a good reminder to everybody to use it as a tool to give information and not to diagnose.
Yeah, yeah. I mean, I think it's interesting because when I'm asking AI and giving it thoughts around my expertise, like marketing and the future of B2B, sometimes it gives me things back that are wrong. I'm like, no, that's actually wrong. That's not how it works in industry. And they're like, oh, yeah, yeah, you're right. Here's this other path. But what's tough is folks that like aren't educated in the healthcare world. Think about the amount of things that it gives us that is wrong that we just don't even know. So I think the hallucinations in healthcare is something I'm like always like, whatever you get, ask it again, ask it about get second opinions. Like we get like get second opinions from doctors all the time. And so I think the same thing if you're using AI for any sort of like solid recommendations, like ask it again, like get a second follow up. I think that's really key. But what I am excited for are more specialized models as well that are like really combining. I mean, we've talked about like your own data, but also like more in depth healthcare and trained. Because right now, when you go and ask ChatGPT for healthcare or anything, it's trained on like the corpus of the internet, including like every part of Reddit, every part of anything. But I'm excited for more AI that's even like more specialized and focused on healthcare. So it's like weeding out some of those things of like who knows where you got that information from, and more on point to like the data and the information that you want as someone looking to optimize your health.
Yeah, definitely. I think it's important, yeah, to keep in mind that no matter how good the models seem right now compared to how they used to be, it's still not a person that's been medically trained for years and years and years. And yeah, we have to be aware of how are they training them and What are the personalities that go with them? Because that's going to tell you a lot about the information you're getting. For sure.
Yeah. And then one last thing, what is like the thing you're excited about the most when it comes to AI in healthcare? Imagining it's like 2030.
I think we're already starting to see how you can connect a chatbot to like your data from your Apple Watch and all these things. I think that's going to be taken a step further. And I'm excited to see more like real time notifications that we get from these things working together and being able to act not just proactively, but like in the moment based on what we need health wise. And maybe even some sort of curated plans, like health plans for people based on data that it tracks over a period of time. So, you know, you wear your Aura ring or your smartwatch or something for a period of time, and then it gives you, like, based on you specifically, based on all the factors in your specific body, this is like exactly kind of like what you said, exactly what you need to be the healthiest you could be. And I think that's going to be just above and beyond anything that we could ever get currently in the healthcare system that we have.
Yeah. 2030. That is so far from now in the AI world. Something that I am really excited about and looking forward to with healthcare in the 2030 is I think just to be a more informed owner of the human body machine. Like, for example, I'm having issues right now with my knees because of so many jumping reps through volleyball when I was young, volleyball in high school, volleyball in college. And I feel like back then, if I would have known like to do less jumps and instead of and to do more strength instead of jumping, I feel like to be able to have it prescribed best practices as a mom, like having children to help your children out to like be the best, most healthiest, to prescribe best things when you're a teenager and you're growing, prescribe best practices in your 20s. Like this is the time to like continue building your muscle because once you hit 40s and 50s, it's really hard to build and just kind of decline. Just being a better understanding of the whole experience of humans and like at what moment you need to optimize, at what time of year, at what time your cycles as a woman. I feel like there is just so much information and so many ways you can optimize. And at this point it's like extremely overwhelming. We're just like, we kind of turn like a blind eye to it because it's just so much. You're like, I just don't have time. I can't think about it. That's just so much information. And I think we'll have something that's either like a manager or assistant or just a full experience. We can like see our whole dashboard that helps us to recommend that because I think there are so many best practices that we just overlook at every point in our lives that's so important to our health and our livelihoods that we just do not have yet. So I'm really excited for that to start to come to fruition. And I would spend a whole lot of money on that for me and my future kids and everyone to kind of live that better, healthier, happier life.